Okay, so we figured out that you had experienced at least 25 different symptoms.
Yes.
Okay, talk about some of those symptoms.
Well, there were, besides the other ones that I mentioned, there was muscle weakness. There was, I don't remember if I said hand numbness and weakness. I started having joint pain in my knuckles to the point where I couldn't grip things anymore. I got extremely fatigued.
Okay.
That was a huge factor. There...
Cognitive issues.
Yeah, it got to the point where I was having trouble just thinking, talking. I couldn't find the words to say, which is still sometimes an issue for me. I was dropping things like crazy, always just, it was horrible.
Balance.
Just constantly running into things. Then, I was getting numbness in different parts of my body. That would just last like a couple of days. But it was just real random, like in my leg, in my calf area, just be completely numb. My foot, one day, the other foot, I started getting a convergence insufficiency where my left eye just started to just wander on its own. And it got to the point where I couldn't read anymore because my eye was always wandering. So they had to prescribe prisons to get my eyes to focus so I could read.
I like how you said prisons.
Prisms. Sorry.
It's like a prison you're in. A prison of symptoms.
Yes.
Yeah. So, talk about your research and leading up to trying to figure out what was going on.
Well, I just started typing in all the symptoms I was having. I just would type it in, search,
so type it in what? Googling?
I just started Googling everything. And things would come up, different illnesses would come up that had that, and it's like, okay, I would read through that disease. It's like, no, okay, I'm not having that problem. It kept coming back to multiple sclerosis.
So you had to, the bottom line is you had to diagnose yourself.
Yes, and then I even went to the doctor with that.
And what did the doctor say?
The doctor at that point said, well, that's one of the things we're trying to rule out. Even though he had never mentioned that to me. It was like, I don't know if he was afraid to scare me or something. But he says, that's one of the things we're trying to rule out.
Okay, and yet they were, the testing process, talk about that. Were they pushing forward to figure out what was wrong with you?
No, I had to keep pushing them.
You had to push them.
I had to keep asking them, what is wrong? This is not normal. What I'm experiencing is not normal to just be going through at such a young age. I should not be having these problems. What's wrong with me? So, working in the medical field, I know that you got to push to get things done.
Okay.
So
they couldn't give you any answers.
Right.
And they didn't offer any advice.
Mm-mm.
And they didn't give you any guidance.
No.
And they didn't suggest any further testing.
No.
So you had to suggest.
Well, I had to ask, what's the next step? Or there was a couple of times where reading about the multiple sclerosis, because there's no one test that will say, yes, you have multiple sclerosis, they have to take a combination of tests to kind of figure out if that's what you have.
Okay, so now let's talk about the testing process. List what you can remember as far as the different tests they did on you.
Well, they did several MRIs, but they did the spinal tap, which came out slightly abnormal, which once again was not definitive for them to say I had multiple sclerosis.
Okay, talk about the MRIs. How many?
Well, it's hard to say. Back then, I had like 2 a year for a few years.
Okay, so at least 6.
Yeah, and then they started doing them every year after I was
And
diagnosed.
eventually they did MRIs that were more specifically designed.
Well, once we were able to ask if there was an MS specialist.
Yes.
They said that there was only one within the medical group that I belonged to. Right. So they referred me to her out in Baldwin Park, and she had specifically modified their MRIs for MS people.
Yes.
And she was the one who actually ended up diagnosing me based on her MRIs that she did on me.
So how long did the testing process take?
It was almost 2 years.
Almost 2 years to get a diagnosis.
Yeah.
So when you finally, this goes back to the beginning of the interview. You finally received this diagnosis. Talk about that moment.
I was relieved.
You were relieved. Why?
Because I wasn't going crazy. It was a real thing that was wrong with me, that I wasn't making this up. I wasn't being a hypochondriac, and I wasn't losing my mind and going crazy like I thought I was.
Okay, so then what did you do at that point?
I asked them, I said, I know there's medications out there. Mm-hmm. And she said, yes, there's, I forgot how many it was at the time, like 4 or 5 injectables. And she said I could basically choose which one I wanted to use.
She told you to choose a medication?
Yes, because it was based on side effects. Which of the lesser one did I want?
So she did not take the initiative to recommend a specific one or prescribe a medication?
No.
She let you choose your medication?
She told me what they were, the side effects, which I had already researched and basically kind of knew about.
It's kind of like pick your poison.
Exactly, that's what it was. It's like, okay, do I want to inject every day and have skin reactions, or do I want to inject once a week?
How did you feel about that?
And have the flu-like symptoms.
The flu-like symptoms, right. Okay, so, but how did you feel about that situation?
Well, I thought it was weird.
Why? That
I was choosing what medication, but I was like, you know what? It's the early stages of MS, so let's get me started on medication and try to stop this thing.
Would you have rather had the doctor give you a specific recommendation?
Well, actually, when it came to those types of medications, in a sense, I'm glad she gave me a choice, because I got to choose whether I wanted to have the flu-like symptoms or do the daily injections.
Okay.
I just wish they were a little more upfront about the side effects.
Okay.
Because it wasn't until later that I really started reading about the medications that I discovered how serious these medications were.
Okay, so let's talk about that. You decided to take the daily injections. Mm-hmm. Talk about that. That experience.
Well, we started on them right away. We got the medications, and I had you inject it because I couldn't stick myself with a needle. Made sure to read all the information about it, because it says do not get it on your skin. It will burn your skin.
The medication will actually burn your skin. And you're putting this into your body.
Right.
But did that bother you?
Yes, and it did, but right at that moment in my life, I was just focused on, I want to help myself. I don't want to get worse, so I want to do this.
Okay.
So we started doing that.
Yeah.
And I started having these horrible skin reactions to it.
Okay, talk about the skin reaction.
For some reason, my legs and my arms were the worst. Oh, and my hips, I think, too. Because you could not hit the same area twice within 7 days. It had to be rotated around on your body so that you only injected in that area once within 7 days.
Okay, so then what happened?
So, like with my legs, after an injection, within, it was like a matter of 30 minutes or so, I would get a welt, like this big, on my leg, and it was red, raised, hot to touch. You could feel it through my clothing, and that lasted almost a week. Every day I could just feel the heat penetrating through my pants. My arms, I would get a welt, but not quite as bad, and it would burn and itch. Same with the other areas.
Okay. So how long did you do this process?
9 months.
Did it help you?
No. But they say it can take up to 6 months for it to actually start to help you.
And it didn't?
No.
What did you experience ultimately as a result of taking this medication?
Well, I didn't get better. I was still having the relapses, and I had all these welts and hard lumps in my body.
How did it affect you emotionally?
Emotionally, well, that was the hard thing. It was like a daily reminder that I had this incurable disease. Injecting myself every day was like, oh, by the way, you have MS and it's incurable. And it made me very depressed.
So at this point, 9 months of taking this medication, you felt frustrated?
I was deeply depressed.
Deeply depressed.
And frustrated, thinking, this is going nowhere.
So then what happened?
Well, you started talking to me about the fact that God has given us, that you felt that God has given us everything that we need to heal our bodies naturally on this earth.
Okay.
And that you thought I should, or we should, start researching that route.
Yeah. And
make changes in our daily lifestyle.
Okay. So what kind of changes, what did you do at that point?
At that point, well, I stopped using the medication. We started researching and coming up with the fact that we needed to increase the nutrients that I was taking in, like vitamin D and different supplements and stuff like that.
Yeah.
But then I also came across the book. A lady wrote, well, there was 2 books actually that helped me change, because there was
what books?
Kevin Trudeau's book, Natural Cures, What They Don't Want You
Natural Cures They Don't Want You to Know About.
Right. And then Anne Baroque's book, Healing Multiple Sclerosis, because she had multiple sclerosis.
Okay, talk about Anne Baroque.
She is someone who actually lives here in the valley, who had MS really, really, really bad, to the point she was bedridden, and she was functioning again. She found ways to change her diet, thinking, and everything.
Okay, talk about the thinking.
Well, it's funny because I didn't portray any of that back then. I thought it was kind of weird.
What?
The whole thinking thing, where the
positive
thinking and the talking to yourself and encouraging yourself. I just, at that point in my life, that wasn't me.
But eventually what happened?
Then I discovered, thanks to Kevin Trudeau once again, I do need to change my thinking. But back then, I wasn't thinking, oh, I have this horrible disease, it's taken over my life, I'm doomed, and I wasn't depressed about that.
Once you got your diagnosis, you knew what you need to do.
Yes.
And so you were finding ways to address the needs of your body.
Right.
Okay. So it actually helped you emotionally.
Right, because then I was like, I got to do something about me.
Okay.
Having the diagnosis was like, I need to make a change.
A change?
Yes, a change in my life.
A change in your life.
Well, back then it was like a change.
Yeah.
It was like I didn't realize what was involved. That's not just one change, it's everything.
Okay.